be talking about some more heavy material. You want to wake your friend up in the corner there?
Friend.
Hello.
Friend.
Reagan. Don't let me throw a shoe at you.
Yeah, when his ain't, he'll probably hit me.
I probably will.
He's gonna give you the boot. Oh.
Anyway, we will be talking about some more heavy material today, so I just want to warn y'all, and I will give you a warning before I show some of the pictures. I do have some graphic pictures to show. We will be talking about child abuse and things like that today, because that is a large part of what we do in pediatrics, but something that you all need to know about. Even if you don't go into pediatrics, it's good to be aware that some of this stuff is going on, so you can kind of be that eyes and ears for a child that may be in need. But I'll give you all a warning before we get to that very heavy subject. So, turn out the lights, I don't see you crying. It's all right if you cry. It's okay. It's normal. All right, so we left off talking about the autism spectrum disorder, and does anybody in here have family members that have autism? Or yeah, so most of us know someone who has autism, and if you know anything about autism, there is a large scale of different degrees of autism. We can't put them all into a singular category. That's why it's called the autism spectrum disorder. A lot of people just think all autistic children or autistic adults are just very aggressive, very loud, very hyper, but they can also be the polar opposite of that and be more what we call Asperger's syndrome. There's all these different syndromes in between that fall under that very large autism spectrum. That being said, they can be a challenge to work with. You really need to communicate well with the parents or the caretaker before you start doing any kind of work on this child. Because if you know anything about autism, the very smallest miscommunication, color, flash of light, movement can trigger their behavior to fly off the rails. So you gotta be very, very, very careful and make sure you get all the information before you start working with that child. Make sure the parents are involved and not just leaving the child with you. If they are by themselves for any reason, you want to get child services involved as well to help you out with that child in case things escalate out of control. So it does range from mild to very severe. They handle the information very differently, obviously. There's all kinds of triggers that can set them off. Autism has actually been found to be on the rise in that 154 children in just the United States alone are diagnosed by the age of 8. So it's a lot more than it used to be, and they really don't know what is causing that rise in autism disorders. All kinds of theories, all kinds of, what's the word I'm looking for? Speculations, fringe theories of what causes autism, but none of that's scientifically proven. You've probably heard people that gets vaccines say that causes autism. You've heard all kinds of different things, but they have not scientifically proven that one way or another as of yet.
Are those considered conspiracies?
That's what I was looking for. Conspiracy theories, yes. A lot of conspiracy theories of what causes that. So the most recognized signs for facilitating imaging procedures are going to be difficulty with social interaction, problems with the verbal and nonverbal communication. Some are very verbal. Some autism is so severe they are completely nonverbal. All they can do is grunt and make noises. That's just, once again, different spectrums, different scales of autism per child. Repetitive behaviors or narrow obsessive interests, that's one of the triggers they look for in a lot of young children to see and test if they have autism disorder, is if your child is very obsessive compulsive with certain behaviors. We actually were scared for a while that Ariel might be autistic because she was very obsessive compulsive as a child, but come to find out she just got too much from me. That's why she's obsessive compulsive, but she did not score anywhere on the autism spectrum. So just because your child does have those behaviors doesn't automatically mean they're autistic, but it's just one of those early behaviors they look for as that can develop into something much more severe as they age.
What kind of behavior?
Like simple example, they're extremely OCD about cleanliness, or they're obsessive about doing one thing over and over again, like from a really young age. Once again, doesn't automatically mean they're autistic, but it's just one of those early signs they look for because that can develop into something more severe as they age.
Also, like overstimulation, like whenever they
Loud noise.
So that's all different. It's on the scale. Some are sensitive to noises, yes, and a loud noise can trigger them, which is why they have the headphones, yes.
Chewing sounds trigger my sister.
Chewing sounds? Your sister is autistic?
My son's autistic.
Mhm.
It's,
Like
he
that
doesn't
or like chips?
Lord, she cries
She
with
goes like
people.
Like just because of the noise or just the anxiety around it?
It's too many sounds.
Too many sounds?
Too many, too much.
She doesn't like ASMR.
Yeah.
So
overstimulated.
is that considered misophonia?
I don't know.
For the record, I don't like chewing noises either.
Yeah.
I don't need
What do you
that.
choose?
The sound of someone
Like
chewing.
smacking?
Some people chew really loud. I don't like hearing people chew.
Like
Just,
when you
it,
talk
like,
about the.
it's like fingernails on a chalkboard to
Yep.
me.
Yeah, like the
They tell
OCD
my
stuff.
husband that.
She's very like her
But he's
hair
not
girl.
really chewing
She doesn't
loud,
like her
it's
hairs
just-
to be like these.
I can hear
Oh,
it.
She has to have like very sleek hair. Like her food needs to be a hot dog. She'll eat the weenie and then she'll eat the bread.
Mhm.
Like stuff like that.
Hey, I'm not autistic and I'll do that, girl.
Hey, Charles, some of us are just kind of strange, right?
Yeah.
I have a lot of those behaviors too myself. I'm very OCD about certain things. So I said, if y'all just move one of my things 2 inches over, I can't
You
find
go,
it.
or you gonna notice it immediately. It's not where you had it. Like
Right.
you can come right in and you'll notice. That's
Yes,
been moved 2
if something's been
inches
moved,
over.
yes, like where, somebody touched my stuff.
Yeah.
I walk into my office at home, I can tell if my kid's been in there, who
You'll
touched my
notice
stuff,
it
so when we move
immediately.
one paper out of place, yeah.
And after
Yeah.
20 years also.
Is it
I'm
true
not
that
in the
all
same place.
autistic kids have like a hidden talent?
It's, I wouldn't say that's like true, but I would say a lot of them do. A lot of them are very gifted in certain things, yes.
Because my cousin, who's like, I think he's extreme because he doesn't speak, and he's autistic and he's very good at doing puzzles. Like the
Mhm.
hardest one, you'll give it to him, he'll do it in like 10 minutes.
Some are hyper intelligent, some are very artistic, yeah.
Yeah.
And the theory for that is whenever certain senses are impaired, the other ones are more enhanced.
Mhm.
So where they might be weak in one area, the other senses overcompensate for that weakness. So they're hyper creative or hyper intelligent, things like that. So very, very fascinating to study.
Yeah.
Very cool stuff. So to provide a more successful imaging experience for your autistic children, ask more questions. They love questions. Schedule the exam when the department is not busy. You want that to be usually your first or last appointment of the day. By the way, one of those nasty registry questions about order of exams. Autistic will always be first or last exam of the day. I put a star by that. Loud noises or visual overstimulation can be distracting. If you have a very loud voice, you want to be careful. If your room is noisy, you want to be careful. Where would this be most dangerous? MRI rooms. MRI can be very noisy for just a normal person, so that's something you need to keep in mind and be careful of. Modify your techniques for patients that are tactile, defensive, or sensitive to touch. Some autistic children, if you so much as touch them or brush up against them, it will trigger them. Different triggers for different kids. Once you touch, maintain the touch until complete. Use concrete language and avoid using idioms, which is like slang, irony, metaphors, and words with double meanings. Be very simple and direct with your speech so as not to confuse and or trigger them to spiral out of control. Special needs patients, consider age when approaching your patients with physical and mental disabilities. Over age of 8, child seeks autonomy and independence. For communication with your special needs children, obviously there's a lot more than just autism. We got a lot from special needs children. Some are very severe, some are very light, but in general, these are the tactics you want to use around them. Talk to the parents a lot. I can't emphasize that enough. Get the parents heavily involved on those exams because the parents know their child. They know what triggers them. They know what they like, what they dislike. Don't just go in there thinking you know how to handle this type of child. Use the caretaker, use the parent, use the nurse, whoever's with that child. Continue your eye contact. I mean, that's with all children. Always keep that eye contact very strong. Children do appreciate being talked to rather than being talked about. I won't mention the name of the tech I worked with who was bad about that. They know when you're talking about them and your voice carries. Never be afraid to ask for assistance. Get the parent staff involved, as these patients will more often than not be combative, especially in a very strange environment. And what do we always relate hospitals to? Scary, I'm hurt, I'm sick, something's wrong with me. So it's just going to be that much more uncomfortable for a special needs child, even though regular children are going to spiral out of control quickly as well. So with pediatrics, you're going to have your good times, lots of smiles. You're going to have your challenging times as well. The hardest part about working pediatrics, guys, is the emotional drainage. If you don't know what I'm talking about, and some of you may experience this just with adults, when you see a lot of really bad things that can emotionally drain you sometimes, with children, that can be 10 times worse. If you've never seen a child go into respiratory distress, cardiac arrest, you've never seen a child die in front of you, you've never seen a child that's been traumatized or abused, it can really mess with the head sometimes. That being said, that's why not everyone is made for pediatric service, because emotions can cause distractions. If you're getting teary-eyed, getting really emotional around children, it's going to make the situation worse. You won't be able to get your job done. I've seen techs completely fall apart just walking into a trauma room because they couldn't handle the atmosphere of what was happening with a child. They didn't last more than a month working there. That's something to keep in mind if you're thinking about pediatrics. You gotta learn to control your emotions. You gotta learn how to cope with the emotions as well. You're gonna see some crazy stuff, really crazy stuff. Prime example there. This happens quite often actually. This is a deformity where the child's heart or organs are born outside the body. We see a lot of preemies that are born like this because the heart can't fit inside the body, their body's too small, it ends up growing outside the body. And it's as freaky as it looks in the picture. The heart's beating outside the body. It's pretty weird looking, pretty strange. They basically keep that heart exposed. They keep them in a very contained area, isolation. Heart is left exposed until the child has grown enough that they can actually fit it back inside the patient's chest. So you'll do a lot of chest x-rays, no pun intended there, but a lot of chest x-rays on these children day by day until they've grown enough to repair that condition.
It is possible to repair.
It is, it is. Another one that happens a lot, same thing guys, with preemies, when the intestines are born outside the body. For these, they'll typically hang them up in a bag above the abdomen. They'll keep them hanging in a bag until the child is grown enough that they can reinsert the organs and restore full functionality for that child. Sometimes the bag will be right on top. Where I work, they often will have that bag hanging above the patient, like a little bit up here. It's really, really weird looking, really strange. And if you've never seen that before, you can't walk in there and be like disgusted, like, oh my God, or like freaking out. Because the parents are there, they're already upset. You gotta keep that poker face, keep those emotions in check. Get your job done, walk away. And it can mess with you, it can mess with your head. It really can. You're gonna see some freaky stuff. Huh?
When they hired you, did they tell you what you're doing?
No, they did not. I went into all this blind.
Really?
Yes, yes I did.
How'd you react the first time you saw something like that?
Well, I didn't react emotionally, but I'll just say,
Did you make a face? Like,
I didn't make a face. I just, I was just very disturbed. Very, very disturbed. I had to go walk around with some music or something. That was my coping mechanism. I would walk around with some music. They have, at Texas Children's, they have mental health care for the workers there because you see a lot of crazy stuff. You have these mental health rooms where you can recover, come to your senses, relax, get your mind off things. They take that into consideration when you work there. So you're gonna see a lot of weird stuff. Yes?
On the picture right there with the intestines, so are they like pushing something down for the intestines to go back in and through
This
the
is showing
through
you,
a tube?
I
or-
mean, this baby's all the same size. Just imagine this baby's like doubling in size though. As the baby grows, they'll be able to start reinserting the intestines back into the abdomen until they're fully
so
inserted.
it's still covered like the tube as they're
Yeah,
doing it.
yeah, it
Oh.
is, until they're all the
So
way
they don't
in.
really okay.
Mhm.
how long does it usually take?
Depends on the child. They all grow differently, different rates. You'll see some freaky stuff like this. I put this picture up here because one of the most disturbing patients I dealt with had this condition. This child survived this, but the one I did was a baby that was premature, and the entire baby's head was a tumor. And this is a tumor. This is a massive tumor. This child still has a brain. The one that I did didn't have a brain. It didn't even have a skull. It was just a big fleshy mass where the head was. But the parents refused to let the child pass. It was a vegetable. It had no brain activity. It was just a sack with a hole where the mouth would be, right here. And they were feeding it and keeping it alive until finally the parents let them pull the plug. But that was, I'll never forget that. That freaked me
So
out.
that
That
child
freaked
does
me
have
out.
a brain in it.
This
That's
child,
on the
this
face.
child
That's
does,
more the
but the
face.
one I did didn't have a brain.
They
Didn't
didn't
have
try
have
to
a brain, he
remove
didn't
those?
even know anything, so that was the case. But
they
if
try
you
to
have a
remove
brain, then it's a problem.
This one they didn't
They
try to remove
removed
it,
it?
but I mean, I don't know if they ever removed this one, but
Yeah.
looks like this child grew up with it. I don't know if that was another country or what, but you're gonna see some scary stuff like that sometimes. Some birth defects are really freaky sometimes, really, really freaky. Once again, you walk into a room and you see this, you can't react. Because when you walk in the room, the parents are watching you like a hawk. And if you react, you're gonna escalate the situation, make it worse for them. As you can imagine, if you were a parent and someone walked in and made a disgusting look at your child that was in a rough situation. So when I say power of the poker face, there really is power of just becoming a blank slate a lot of times and just getting your work done. And of course, you're gonna see some children that have been through it. I'm not going to expand on this too much yet. It's going to come a little bit later today, but you're going to see a lot of child abuse cases. And I did not realize this until I moved to this city and started working in pediatrics, just how much child abuse there is out there. I'm going to show you all some statistics in a minute to show you what I'm talking about. I grew up in a very small town. This stuff just didn't get talked about. I was very unexposed to this kind of stuff. But there is some real evil people out there, and there is a lot of mistreated children, an exceptional amount. There's signs you look for. We're going to go over those, but we'll get into that in a minute. But you're going to see some angry parents. You're going to see some depressed parents. You're going to see some traumatized children. Once again, I'm just telling you this because you've got to take your emotions out of it. To be successful in pediatrics, not that you become a robot, because we can always be sympathetic and empathetic, but you've got to become a blank slate on your face and not let that affect your job performance. So, psychological considerations, like I'm telling you, maintain that calm tone and manner. Keep in mind, parents may speak with a tone of anger, urgency, usually from fear and not aggression at you. Communicate what to expect, everything you're doing. You don't want to just walk in and do everything silently. You want to make sure everyone knows what you're doing and why. After the procedure, explain what will happen next. Usually you don't have to do that because they're going to ask you every time, what's next? What's next? Or they're going to say, what's on the picture? What's on the x-ray? Of course, you can't share that, but you use that line, the doctor's going to give you the results in a few hours, a few days, whatever. Find a coping mechanism. That's my biggest recommendation if you want to go into pediatrics. I had to learn to do this myself. As I already told you, my thing was after I saw too much after a shift, I'd just take a break, go walk around with some headphones on, listen to some music, have a snack, or find myself a little quiet area to come back to my senses. If you don't learn to find a coping mechanism, it can mess with your head after a while. I will say that. You've got to learn to cope with the amount of stuff you see. Psychological considerations continued. Inpatients are going to be your most stressful exams. That's where you're going to see some of the worst stuff, obviously. Children who've been in severe car accidents, severe injuries, child abuse, struggling for their life. The child's going to be most fearful due to separation from parents, a strange environment. You're going to see tiny babies with a million tubes on them, machines all around them. Parents are often going to be very stressed if you've never had a child in the hospital. If you ever had a child in the hospital, you know exactly what it's talking about, juggling work, siblings at home, worrying about the health of your child. That can be very traumatizing for a parent, obviously. So you have to learn to work with those parents that are traumatized. Be that comfort to them, that you're giving care to their child to help them recover. Premature infants, make note of that. That's a regulatory question, by the way. Greatest danger for your premature infants will always be hypothermia. That's why you always want to keep the rooms warm. Make sure they're in their isolates when possible. Use your mobile radiographs, because if you have a child this small, good luck getting that to your room. Not probably going to happen. And they do get that small, guys. Look, that hand's bigger than my hand, but because it's zoomed up, but they'll fit in your hand. That's small. That's small, yeah. So super fragile, very easily coding. You got to be very careful around those types of children, obviously. Outpatient, if you ever get to work at an outpatient facility for pediatrics, that's going to be the easiest and the best times, I would say. Your walkie-talkie patients, less stressful, very easy, and probably the best experience with pediatrics overall. But you don't know if you're going to work in an outpatient or inpatient facility. It just depends on what shift they have available to you. Take notes on the following: specific instructions regarding care and management of a child while in the department. Always make sure if you know the nurse or other healthcare professionals coming with the child, make sure they're staying with the child. When I always tell you stories of me getting mad at nurses, it would often be because they would bring a child over and just leave them there. Yeah, don't let them do that. Make sure they stay. What physical limitations influence the way the examination is performed? Case by case basis, obviously. And always practice your standard blood and body fluid precautions. Adhere to isolation protocols carefully. That's just the same stuff we've talked about with patient care for our adult patients as well. All right, so we're about to get into some of the rough stuff now. Just to give you a warning, if you're sensitive to this stuff, if it's too much for you, you gotta take a breather. I understand, I'm not gonna take offense, but we're gonna talk a little bit about child abuse, some statistics, and talk about some signs to look for so you can be that advocate for a child if you ever see something happening to them.
Can you
Question?
turn on that TV?
Yeah, it's turning
They've been
off.
really wonky today. It's like scratchy
They're
and
both
stuff.
working strange.
Me too.
So-
Flipping out.
With child abuse, this is actually what fueled the entirety of my dissertation that I'm working on now.
Thank you.
For those of you who don't know, my dissertation is on childhood trauma, and it's linked to adult mental health and learning outcomes. And very, very important topic. Very important topic to talk about. A lot of people don't like to talk about it, but it's good to be aware of this stuff because, believe it or not, you can actually save a child's life indirectly just by recognizing certain signs, or even showing that child a little bit of love that they may not be getting at home. 2 of my children are adopted, and 2 of them went through pretty traumatic upbringings because even though they were babies, they both were addicted to methamphetamines when they were born because the birth mother of my 2 children was heavily addicted to methamphetamines while she was carrying the child, both children. So they both went through withdrawals as babies when they were taken off of the methamphetamines. And it was very traumatizing to both of them. Hopefully that's not going to manifest in something later as they develop, but they have shown that even as a child, like a baby, traumatic things that happen to babies can manifest into outcomes in adults as well. So something we're obviously monitoring, but something to be aware of and something to keep in mind, especially if you know someone who's being mistreated. It's something you always want to report immediately, let somebody know and get them out of that environment. So talking about some statistics here, guys, this is from the year 2021, number of cases of child abuse in the U.S. in 2021 by type of maltreatment. Neglect is a big one. That's the most common occurrence that we see. Now, what's neglect? Neglect can be as simple as not tending to the needs of your child, not listening to them, not speaking to them, but that can be starving your child. That can be just leaving them isolated. There's a million forms of neglect out there. But 446,838, this is the United States, guys. This is one country, 446,000 reported cases. Let's not even talk about the ones that are unreported. Neglect can be extremely severe. One of the worst neglect cases I saw at Texas Children's was a child was brought in and he was being starved to death by his parents. He hadn't been fed for weeks at a time, and he was kept in a closet at the parents' house, and the only way he stayed alive was by drinking his own urine. And he was like this big around, like just skin and bones. And the worst part of that was that we'll talk about the 100-yard stare. You ever hear the 100-yard stare from soldiers that come back from war? It's kind of like stare into space. That's the look he had on his face. Like he was just dead. There was just nothing left. He was 6 years old. 6 years old. And he had been beat with a stick. He had lashes all over his back. Really horrible stuff. Really horrible stuff. So he was physically abused and neglected. So a lot of these overlap as well. Second most prevalent would be the physical abuse. That's, of course, physical abuse, hitting the child, throwing the child. Yes, people throw babies. I've seen that a lot. They throw babies, they kill babies, they shake babies, they strangle babies, they strangle children. All this stuff would fall under your physical abuse. Sexual abuse.
By mistake, but on purpose.
Both. It still counts as abuse though, even if it's an accident. They always want to say it's an accident. Sexual abuse, obviously that speaks for itself. Any kind of molestation, touching of a child, or having sex with a child. The worst case of this that I ever saw was at TCH, a child was brought into the trauma room, a 2-year-old, he was dead, and he had been raped to death by the father. And there was just a hole. All that stuff, there was just like a hole. I won't go into much more detail on that, but there was just a big gaping hole, and they had to call the whole homicide team, and they found traces of the father's DNA and hairs all over the child, and he was immediately arrested and put in jail. And I'm sure he was killed in jail because they don't treat child abusers very nice in jail. I have no mercy for people like that. But that was probably the worst sexual abuse case I saw. They had to bring a whole homicide team in, but you're gonna see a lot of those as well. Psychological maltreatment, psychological abuse is a big one. 37,000, medical neglect, sex trafficking, big in the Houston area, unknown, and others. Some are just not classified at all. And this is just 2021, and this is just the United States. This does happen worldwide. And once again, I didn't realize this until I moved here, just how prevalent, because when I say every day I was at TCH, we were doing skeletal surveys to check for child abuse on children daily. It's really frightening how much of it is out there, and how truly evil people can be.
So when you're talking about sex trafficking, it's babies you're talking about.
That can be children, that can be teenagers as well.
Teenagers.
Mm-hmm. Mm-hmm. Yeah, remember 0 to 18, 0 to 17 is considered a child. Mm-hmm. All right, so the number of cases of child abuse in 2021 by age, a lot of people would think it's older children, but actually under 1 year old is the most common abuse age. And 2021 it was 88,571 under 1 that was abused. That's all the stuff together, by the way, there. 38,000, and it kind of goes down as they get older, as you can see right here. But most commonly, you're going to see it in your small infants, which is sad to see, which is very sad to see. Yeah, I don't, for my life of me, I just cannot understand how anyone can, maybe it's just the father in me, I don't know, I can't see how anyone can lay a hand on a child like that, much less a baby. It just blows my mind. But there's evil people out there. There really is evil people out there. There's just a few examples of physical abuse right here. This child was punched in the face several times. This one as well. This baby was lacerated, punched in the face. One of the things you want to look for are unexplained cuts, bruises, swelling, especially if a child is acting very nervous when you ask them how they hurt themselves. Another big one, and usually this is very scarily common among people that are physically abusive, is cigarette burns. When you look at a child, if the thing looks like a small round cigarette burn, make sure you report that immediately. Any of this report immediately, but that's a very common thing you're gonna see as well as the cigarette burns. I saw more cigarette burns probably than anything else. I don't know what psychotic evil people do this stuff, but yeah, I saw that a lot. Yeah, yeah. This is it. This is kind of what that boy looked like I was talking about with the neglect.
It's all
Yes.
So you're talking about the cigarette burns? So, like, if you notice that, do you do the exam and tell them
Yes.
afterwards?
You do the exam as if nothing's happening.
Okay,
You don't want to
and
let on that you
afterwards.
suspect anything.
Yeah,
Because we've seen cases where people run.
yeah,
Like if they think something's up, they run, they take off, they get out of there.
yeah.
These parents are going to act very strange. And we all have 6 senses. You're going to get a vibe a lot of times as well. Usually if there's something wrong, there's something wrong. So you would let someone know immediately, like when they are out of the room. You call the nurse's station, you call the doctor, you let them know what's up, so they get CPS there immediately. If they have not already started, which a lot of times they have already, they already know. But just in case they miss something,
Sorry, so what's CPS?
Child Protective Services. You want to get them out of there. Like I said, you might save a child's life. Seriously.
So are those cigarette burns in that one?
Yeah, that's some cigarette burns. This is that stare I was talking about. Even little babies can have that stare. You want to look for that. You see, like once again, your sixth sense is telling you something's wrong. Usually it means something's really wrong. You want to report that immediately and let somebody know.
And not all burns look like that.
Not all burns, they don't. They really don't.
She said, like, living so many years of my life, I have not seen them, and they'll only show up in hospitals because
I've seen too much.
in,
Yeah.
like in normal life, you don't really get to see them.
Well, that's how I was growing up. You just didn't think about this kind of stuff, but yeah, it's very prevalent. It's very, very, very sad. Very sad.
They're not just in hospitals though. They are in normal life. You can see them everywhere.
And I say it once again, guys, because believe it or not, it is very difficult to get these children removed from a parent's house. CPS, their ultimate goal is always to reunite the child with the birth parents and keep them in the birth home. Even little Lily, we had to go to court to get Lily's custody because even though they found drugs in her system, and by the way, when we got Lily at our house in the middle of the night, the parents had hid her. Did I tell you the story how we got Lily? So little Lily, she was born in secret during Hurricane Harvey. During Hurricane Harvey when it hit here, and the parents somehow got past everything with all the chaos going on with Hurricane Harvey and was able to bring Lily home. They didn't have their history or something or another, otherwise she'd have been immediately removed. So Lily was brought home in secret, and they ended up taking her back to the hospital for another appointment, and they made a mistake. They went to the wrong hospital and they had their record on file. And they immediately gave us a call and removed her from the environment, and they said she was living in filth. She didn't even have a baby bed. She was just laying on like a bunch of blankets on the floor. She was covered in trash and filth, and the whole building was just like condemned. Disgusting. Drugs everywhere, methamphetamines everywhere. Just very, very disturbing environment. They brought her to our house immediately. her stuff in a trash bag, and her little frozen blanket, which she still has, by the way, her little Elsa blanket. But
So it's because they knew that you were going to adopt Lily. That's why.
well, we were fostering. We had Benjamin, so they did what's called a kinship placement to put her with her sibling. So anyway, we ended up having to bring her for visitations with her mother because they were still trying to reunite her with the mother, even though the mother never showed up for any visitations. We'd bring her to the CPS office every month. The mother would never show up. Went all the way for a year. We ended up going to court, and the mother was there to fight, and the father was there in shackles because he was in jail. He was there to fight for custody, and they were still trying to reunite, but we had a good lawyer. God bless our lawyer. I don't know what she said to the mother, but she got the mother to agree to give up custody. And I don't know what she said to the father, but they got him to agree after 3 hours of convincing him to release custody. But my point is, it is very hard to get these kids removed from these environments. Even if they're removed, they're often brought right back because the system is very bad, very, very bad.
Yep.
So when I say, if you can show that child a little bit of love for one day, like 10 minutes that day, that might be the only love they get for that whole month. So go that extra mile to connect with that child, do something kind for them. Even if it's an active service, get them an x-ray. That might be the only positive thing they get in their life. I always say keep that in mind. Treat every child good, but especially in those cases. I'm sorry, I saw a bunch of hands go up. Jay, I saw yours first.
So, with that, are they going to like remember and be affected by all of that, like those proceedings and the just hiccups in the system? Whether, like,
You talking about just a random kid?
no, well, in the case of your children, would they remember going to the courts, and would they remember
Well, I
going
mean,
to the place? And
she was less than a year, so probably
okay,
not.
so probably not. That's good.
Yeah. But we'll tell her. I mean, we've been very open. Like, they both know they're adopted. We talk openly about it. So we share everything with them. Make sure they're aware. We don't want to hide any of that from them.
But that is important.
Emily? Question?
So you had Benjamin and then they called you like Lily.
Yes.
Did
Well,
y'all
Benjamin
like
was-
expect to get Lily?
Benjamin
or-
was an automatic move because their birth parents don't like boys. They only like girls.
What?
So they gave him up immediately. But for the girl, they wanted to keep her.
So
Scary.
if that
Yeah,
mom
you're
That's
the
weird.
one that wanted to-
was to
Yeah.
have another one, but they said
They
to
would
you-
call us first. Yes, they would. We're certified foster parents, so
Yeah, but they would call y'all because you already have two siblings and they all stay together, don't they?
yes, they try to. They have two older siblings that live in Colorado
Yeah, I think you
as well.
mentioned. They've met or
They have met. They met actually a few months ago for the second time. It was actually really, really sweet. Really sweet. It's almost like it's like their second time in is almost like they've known each other their whole life. It was really cool to watch.
That
Mhm.
the other children taking good care of as well.
What?
That
Yeah,
is
they
a-
are. They are. Yes.
Are they
Okay,
both
this is a bad one, guys. This is a really bad one. I'm sorry, and this is actually pretty light compared to some of the stuff I could show you. I'm trying to not traumatize you the rest of your day, but this is Brianna Lovelace here, and you can read her story. She was severely abused as a baby, and so her parents eventually killed her with the abuse. This is the post-mortem photo right here. But my point is to show you there's some evil people out there, and they do this to babies, children. Be aware, keep your eyes open. You never know what kind of life you might save to get them removed from that environment. That's why I'm not just doing this for shock value. I'm doing this to make sure you're aware that this does exist out there, and keep your eyes open. Keep your eyes open.
Did you ever experience that?
Yes. Yes, multiple times. I've done more x-rays of things that have passed than I like to admit in the morgue, yeah, for multiple reasons. One reason I was glad I got out of pediatrics, as a father, it started really messing with my head a little bit too much, but yeah.
Only for postmortems they need X-rays.
Yes, in the morgue for autopsies.
Forensic evidence.
Yes.
Did they change her name
They-
for
Did they change the name? That's the actual name.
Her name was Loveless.
Yeah, strange enough, right? And this is that stare you want to look for again, guys. That look on her face. You want to be sensitive and be aware of that.
Same child, right?
This is all the same child. This is early on, and you kind of see the result after just a few months of abuse right here.
Bless
Bless
you.
you.
Thank you.
Okay, so what do you want to look for, guys? Big one, of course, is bruising. That's going to be 90% of your abused children. Any bruises that, and you got to be careful because, look, my son, he's bruised up all the time because he's always climbing and running and bumping into everything. But there are certain types of bruises in certain areas, namely the groin area, which should not be there. That's one of the big ones you want to look for. Any bruising near the groin area, or just bruises that look very severe. Normally rare in your young, immobile children. You should not see a lot of bruises on an infant. That's a big red flag, obviously. You see a big giant bruise or a black eye on an infant, hello, what happened? You can't say the baby accidentally, how's the baby gonna do that? No. You wanna look around the joints, arms, elbows, wrists, hips, and knees and ankles because, and I'm sorry this is graphic, but what a lot of people do is they grab children by the limb and they shake them around when they're mad at them. Or they take them by the limb and they throw them. Or they take a baby and they shake it like this. Neck bruising, that's what you want to look for as well. If it's unnatural, you want to immediately report that. Even if they've already been seen in the EC, put all your documentation in there. You're building a court case for that child to get them out of that environment. Keep that in mind. The facial stares, this is seeing victims of repeated abuse, and it's described as a vacant facial stare. So the child's going to basically switch off all emotion and events to try to detract from the abuse. That's a natural thing that happens to children who've been severely abused. You're going to see that facial stare, that blank, emotionless stare. They don't respond, or they respond very slowly to questions by a healthcare worker. They appear to be divorced or detached from the situation. And these can be physical, verbal, or emotional detachments the child may have. Something else you want to keep an eye out for and look for possible abuse. Abuse victim. So once again, warning signs: bruising on a baby, bruising to the ears, the neck, torso, buttocks, or genitals of any child under 4 years, unexplained injuries on children of any age, especially if you question them. One of those big red flags is if a child acts very scared to answer. If you ask, how'd you hurt your arm? Or they kind of look away, or they look to their parent. Or if the child's about to answer something and the parent immediately interrupts the child and says, oh, quiet, honey, I'll answer for you. Big red flag. Big red flag there. Sexual abuse, increase in nightmares, sleeping difficulties, withdrawn behavior, angry outbursts, anxiety, not wanting to be alone with a particular individual. One thing I forgot to mention on physical abuse, because I've seen this a lot. If you ever notice whenever you go towards a child, like, hey buddy, we're gonna do the arm x-ray, and I reach towards him and he does this. See what I'm doing?
Flinching.
What do you think that tells you? That they hit him and he's used to reacting to the hit. I've seen that a bunch on abused kids. That's a big red flag. Fear of telling, afraid to tell about their abuse because they feel ashamed, don't want the abuser to hurt them, don't want to cause stress, don't want the abuser to go to jail. Because hey, that's still their mom and dad. And it's a crazy dichotomy. That parent can be beating them half to death. They still love their mom and dad. So keep that in mind. Keep that in mind. Neglect, that's going to be your failure to meet basic needs, failure to provide nutritional needs, that's going to be your malnourished kids. Physical abuse, we already talked about, sexual abuse, and emotional abuse as well. That's a big one right there. That's going to affect, always going to affect mental health as they grow older into adults, as my research has been showing. But that's going to be your signs to look for, guys. Signs to look for. So, yeah.
Are we going to talk about Stockholm Syndrome?
Stockholm Syndrome, about how someone grows attached to a kidnapper?
Or their abuser?
We can. I didn't have it in there, but we can. Stockholm Syndrome is if a kidnapped victim starts to have feelings for the kidnapper. It's a rare phenomenon that does happen, but it can happen. Yes. Yes, Stockholm Syndrome. One of the famous ones they like to joke about is the Beauty and the Beast. Is a case of Stockholm Syndrome because Belle fell in love with the Beast even though he kidnapped her. Probably a bad example there, but
It's pretty awful.
Would it still become, like if they kidnap him at 2 years old and they grow up and think, oh, that's my mom, of course I love her.
yeah, absolutely. So suspected child abuse, guys. Suspected child abuse will often be labeled as such on an order form. Make sure you read why they're there for the exam. Also, it can be labeled as NAT, non-accidental trauma, one of those things you want to look for. It's going to be the involvement of physical injury, sexual abuse, deprivation of nutrition care or affection, and circumstances which indicate the injury or deprivation may not be accidental or may have occurred through neglect. And remember, once again, abuse is not primarily physical, even though a lot of it is. It can be very much mental as well, very much mental. A parent who constantly degrades their child, that child's going to grow up with psychological difficulties. That's mental abuse. Mental abuse is on the rise a lot as of late in the past few years, and they blame that a lot to the isolation we had during COVID, because they said we spent too much time together. That's the excuse they use for that. It's not ever an excuse, but mental abuse has been on the rise, unfortunately. So reporting, I don't know why that's so out of order there. Reporting suspected child abuse, you're going to refer them to the child life specialist. At Texas Children's, they have CPS always on duty that you would report these things to. A couple of the labels: BCS, past battered child syndrome, present non-accidental trauma, NAT. Always report suspicion to the radiologist or attending physician immediately. Put everything in your notes as well. Because once again, you're building a court case for that child in the hopes that you're going to get them removed from that very traumatic environment so they can have some quality of life as they grow older. Also, when I always told y'all the importance of markers on pediatrics, that's where that comes into play. If you're doing x-rays of a child that's been abused and your marker is not on that x-ray or it's a digital marker, they throw it out as court evidence. If they brought this child to court to try to get them removed and all the evidence they had was your x-rays and you were sloppy and didn't put your physical marker on there, they consider that to not be evidence. They'll throw it out. Jay?
Has that happened to you or a coworker where?
Me personally, no. I always make sure my markers are on there. In fact, at TCH, we always made everyone repeat if they didn't have their markers, period. We would never pass anything with digital markers.
So they would rather expose the patient to
They
more
would.
harm than.
Absolutely.
Yeah, dog is
Yes.
going through so much.
Yes.
Would you get in trouble for that?
Yes, written up in termination eventually for not having your physical markers.
Like,
They're hardcore there about that. Absolutely. All right, so what about x-rays? Some things you want to look for on your x-rays in case this child has never been reported as an abused child. It's their first time in a hospital. If you have a baby come in or a child and you notice those rib healing fractures. Healing fractures in the ribs are very distinct. They look like little round balls, like little rounded shapes. See that? If you ever see that on a child chest x-ray, let somebody know immediately. That is a sign of previous abuse. A baby should not have busted up ribs at any point, period. I don't care what the parent tries to say.
so you know how technically, I mean, we're not supposed to read it, but it's like obvious, and you report to your supervisor, or
You report it to the attending physician and the radiologist.
so then he has to call, like
Mhm.
CPS.
Like if it's really bad, you can go ahead and call CPS yourself, 100%. But the protocol is to let the doctors know first, and they'll take it from there.
Can you get fired if you don't let the doctors?
I wouldn't say you can get fired, but it's just
It's like a
bad.
chain of command.
Chain of command.
I have a question.
Yeah.
That these ribs that can never break in childhood.
The what now? The
In
ribs?
childbirth, yes.
Ribs, no.
They can-
No.
Not
No,
in
no.
delivery.
Childbirth, your most common fracture is going to be on the
Clavicle.
clavicles. Clavicles, yes. Or limb. Should not be limbs either, but can happen.
Yeah, but once you like broke,
Mm.
because they pulled it.
Oh, they pulled her. So,
Yeah,
okay,
they pulled
that makes
her,
sense.
so it broke.
Yeah, yeah. Jay?
Oh, I was just gonna say, my pediatric upper extremity is a clavicle of some person that was born that day.
Yeah.
So that's
Very
pretty
common.
cool.
Very common.
Say
So
happy
your
birthday.
rib fractures, guys, look for those. Your corner fractures. Corner fractures are gonna be like the corner, like the very tip or corner of a bone is fractured. It's a very common abuse type of fracture. Bucket handle fractures of the limbs, and any type of healing fracture, period, especially on infants. Once again, if you see their femur has a healing fracture, that should be a big red flag. Something's not right there. If you got a 1-year-old and their humerus has a big healing fracture on it, big red flag. You can always look at the history if you suspect, but better just go ahead and report that just to be on the safe side. That'd be a corner fracture right there. Very common femur fracture, by the way. That occurs from the patient twisting the parent twisting the limb. You actually twist the limb of the child because they're mad, angry at the child.
Look, Shanae, I can't work at
That's an arm.
I know.
That's
I
a
can't.
leg.
Ready to
Fighting
fight.
every day.
This is, no, that's a knee.
That's
It's a femur.
Why did
I can never.
kneecaps?
Why don't they have kneecaps?
No, what are those? What are those circles?
You should know what that is. What is this?
Why is there two?
You tell me, we've talked about that multiple times. It's growth plates. It's not fused yet.
So those are the
This
epicondyles.
is part of the femur, that's part of the tibia. It hasn't fused.
Little bitty legs.
There's
So-
another case of severe breaking. I mean,
That
obviously,
knee-
something like that lets somebody know.
That knee that we just saw, they got kicked, and that's what that fracture was
Likely,
from.
yes. Likely.
Kicked the side of the knee.
Knee.
Yeah,
Oh.
they kicked the middle of the knee.
This is a result of multiple fractures over a period of time. This poor kid's arms are completely deformed. Huh? This? I don't know what that is. Another one that I saw was really bad. This kid's ankles were severely deformed, and reason being, this was a 7-year-old who's actually he had the 100-yard stare going on. He was kept in a closet as well, and he was kept in shackles.
Oh.
Parents had him shackled, actual like almost like medieval shackles from like a castle or something. And he was very malnourished, and that had been going on for, if I remember the story correctly, been going on for 2 years. 2 years of being in shackles, and it had the shackles on his ankles for so long that when they removed the shackles, his flesh and muscle was like necrotic. The ankle was like rotted, and like his muscle and the bones were exposed, and it was bad. Gangrened. It was horrible.
What is it, what do you think is the reason for them doing, keeping a child in prison? It's like just getting,
It's just there's some evil people out there, Shaheen. There's some
Just
very
makes
evil
them
people.
feel good
They
about
are
it,
obsessed
that
with
they can
control and order, and just some people have a sick pleasure of torturing people. When I say there's evil out there really is evil out there. Just some sick people. And I have no sympathy for them. I hope they go to jail, and I hope they get taken care of in jail. That's all I gotta say. That's all I'll say.
As soon as they step off the bus.
That's, I always say, Bubba in jail is gonna take good care of them. When they find you're a child abuser, you're
When
the one
who picked your kid, right?
I got my friends.
yeah. He had to have both his feet amputated. Yeah, I didn't end that story. He had to have both his feet amputated because the ankles were completely gone. Okay, I need a break. Let's take 10 minutes. That's
People are sick.
hard to bring all those memories back up. Let's take a quick break, guys. Let me have a breather.